Welcome back to Morning Joe. Joining us now, director of the Harvard Global Health Institute, Dr. Ashish Jha. He is practicing physician, also professor of medicine at Harvard Medical School, and somebody we have relied on an awful lot over the last few months here. Dr. Jha, it's great to see you again this morning. Wanted to bring you in to offer some clarity to our audience about this announcement and then sort of amendment to the statement from the World Health Organization that asymptomatic transmission was, quote, very rare, because what we've been told is that we don't want to go out in public. We don't want to mix with people. We need to maintain social distancing because we may have coronavirus and not know it. And even though we feel well, we could be spreading it to other people. What did you make of the WHO's statements yesterday?
So good morning, Willie, and thanks for having me on. I mean, the bottom line is this. There are people out there without symptoms who are shedding virus and spreading the disease. We've known that for a while, and that continues. Nothing here has changed. WHO was trying to make a distinction between asymptomatic and pre-symptomatic people. Scientifically, this is an important distinction. But functionally, what it means is that there's still lots and lots of folks out there who feel totally fine, are infected, and shedding virus. So we got to wear masks. We got to maintain social distancing. Nothing has changed. And I wish WHO was a little bit more careful about how it talked about these things, because it has sown a lot of confusion.
And so what practically should Americans, what should people watching this show right now do with that information? Does it change behavior?
No, that's the bottom line, Willie, is that nothing here is different. There's no new study. There's no new data that they're pointing to. There is a group of people who never, ever develop symptoms. Those are truly asymptomatic. And what WHO is saying is that they're not finding that those people shed a lot of virus. But there are a lot of other folks who feel fine, do shed virus, do infect others, who will later go on to develop symptoms. Functionally, it makes no difference in terms of whether you should wear a mask or not. The answer is yes. Whether you should socially distance or not, the answer is yes.
So, Dr. Jha, I'm interested in your take on a discussion that's been taking place over the last couple of weeks now, which is that for 3 months, the country has been told not to go to work, not to go to school, not to go to summer camp, to stay at home to prevent the spread of this disease. And now we've seen for 2 weeks tens of thousands, hundreds of thousands of people packed into the streets of this country, obviously for a cause that is just, but obviously an epidemiologist or a public health expert like you has to cringe a bit, not for what they're protesting and what they're demonstrating in the cause of, but for the public health concerns. How worried are you when you see those pictures of huge crowds of people together in the streets?
Yeah, so I do think that the protesters have a righteous cause, but unfortunately, a righteous cause does not mean that the virus isn't going to spread. So I look at those and I worry. Now, there are a couple of things that make me feel a little bit better. We do think being outside helps, that there is less spread outside. When I see protesters wearing masks, I feel better. And at the end of the day, Willie, even in the most optimistic estimates of how many people are marching, is less than 0.5% of the American people. So while I'm worried that it will fuel outbreaks, I don't think it's going to end up being a source of major outbreaks unless the protests continue for quite a period of time. And then, of course, we're going to have to worry more.
All right, Dr. Jha, we'll keep it up in Boston now. Mike Barnicle has a question for you. Mike?
Dr. Jha, as you know, Massachusetts is slowly reopening, began Monday reopening. Are we reopening too quickly? Are we reopening the proper way?
Yeah, so Massachusetts, I think, has done a very good job. And Governor Baker, I think, has been careful, has really staged this out. We've seen substantial declines in cases for several weeks now. Testing has gotten better. It's not where I want it to be. And I've been pushing the state to ramp up testing more. And they say they're trying. But I think in general, they've done this slowly and carefully, and that's a good thing.
All right, Dr. Ashish Jha of Harvard Public Health Institute. Dr. Jha, thank you so much. We appreciate it as always, and we will see you again soon. Coming up next on Morning Joe, Republican Senator Lisa Murkowski says what other Republicans are not willing to say. Quote, "I cannot live in fear of a tweet." We'll discuss that when we come right back.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.